In today's fast-paced digital world, one of the most overlooked yet powerful influences on heart health is constant exposure to stressful news. Because every alarming headline, breaking news alert, tragic story, or sensational debate triggers a stress response inside the body that was originally designed to protect us from immediate danger. But when activated repeatedly throughout the day, especially during recovery from heart disease or surgery, this response quietly strains the heart instead of protecting it. When you consume stressful news, your brain perceives threat, even if you are physically safe, and immediately releases stress hormones like cortisol and adrenaline, which cause your heart rate to rise, blood vessels to tighten, and blood pressure to increase, forcing the heart to work harder than necessary. And over time, this repeated stimulation contributes to persistent high blood pressure, irregular heart rhythms, increased inflammation, poor sleep, anxiety, and delayed healing, which is why cardiologists increasingly emphasize emotional and mental calm as a critical part of cardiac recovery, not just medications and physical activity. For heart patients, especially after surgery, angioplasty, heart attack, or in conditions like hypertension or heart failure, the heart is already healing and adapting. And frequent stress surges from disturbing news can interfere with this delicate process by increasing oxygen demand of the heart muscle, worsening chest discomfort, triggering palpitations, and raising the risk of complications, while also weakening the immune system that is essential for healing wounds and fighting infections. Beyond the physical effects, stressful news also affects behavior by increasing worry, fear, anger, and helplessness, which can lead to shallow breathing, muscle tension, poor digestion, emotional eating, sleep disturbances, and avoidance of healthy routines like walking or relaxation, creating a vicious cycle where stress feeds illness and illness feeds stress. Avoiding stressful news does not mean being uninformed or careless, but rather choosing mindful consumption by limiting exposure to specific times of the day, avoiding sensational or repetitive coverage, turning off constant alerts, and prioritizing reliable, factual updates instead of emotionally charged content. Because the heart responds not to information itself but to emotional intensity, and reducing that intensity allows your nervous system to shift from fight or flight mode into rest and repair mode, where heart rate slows, blood pressure stabilizes, blood vessels relax, digestion improves, and the body can focus on recovery. Studies have shown that calm mental states support better heart rate variability, lower cortisol levels, improved sleep quality, and better long-term cardiovascular outcomes, which is why practices such as gentle music, reading, prayer, meditation, deep breathing, nature exposure, and positive conversations are often recommended alongside medical treatment. Family members and caregivers also play a vital role by protecting recovering patients from distressing discussions, loud debates, or non-stop news channels in the background, because even passive exposure can activate stress responses, and creating a peaceful environment is a form of silent therapy for the heart. Remember, healing is not only about what medicines you take or how much you walk, but also about what you allow into your mind. Because a calm mind sends healing signals to the heart, while chronic stress sends danger signals, and by consciously avoiding stressful news, you are giving your heart fewer shocks, your blood vessels more relaxation, your blood pressure more stability, and your nervous system the space it needs to support recovery, resilience, and long-term heart protection, making this simple habit a powerful, doctor-recommended step towards stronger heart health and emotional well-being.